All right. 5:30. I'm on time today. Thank you all for joining me. So some of you just had your history visit with me this week. Hi, good to see you again. And some of you will have your history visit coming up, not tomorrow, but Friday. So I'm going to go ahead and start sharing my screen so that we can get going. I will not waste your time. Let me know when you're able to see the presentation. Raise your hands. All right, awesome. Or send a heart. Yes. Awesome. Well, welcome to the Full Circle Women's Care Practice and Pregnancy Orientation. I'm your host, Dr. Adams, and today we have a lot of information to get through. Housekeeping items first. Everything here is confidential. So if you answer a question, no one can see it was you. If you ask a question, no one can see it was you. So I will answer your questions without saying your name or letting anybody know who it may possibly be, even if I recognize you. So please feel free to participate. I have poll questions hidden throughout here to make sure that you're still awake and engaged. And then if at any point you have to hop off during it, don't worry. This will all be available on our YouTube channel for the duration of your pregnancy. So here's an example of the poll questions. So first thing, and it helps me when you guys answer them because it lets me know like how much time do I really need to spend on this. So for this one, for example, who's on the call? How many first-time moms do I have? How many veteran moms do I have out there? So when you answer them, like I know what's coming next, and so I'm like, do I need to flesh that out a bit more? So I'll talk a little bit, and then I'll say polls are closing in 3, 2, 1, and then I will close the poll. And then I will share the results. Whoa, today we have a lot of first time moms compared to veteran moms. So, yes, we will spend time on the nutrition and exercise and all the things that you haven't heard before because this is your first time doing this. Okay, cool. So, the things that we are going to go over will include the full circle experience, which includes where we deliver. We'll go through what our office protocols are, like best ways to contact us. We'll go through what to expect at your pregnancy visits. I'm going to give you lots of prenatal resources, which remember, these will all be available on our YouTube channel afterward. We're going to go in depth on exercise and nutrition in pregnancy, and then at the end, kind of wrap it up with an upper respiratory illness update because we are still in upper respiratory season. So first, a little bit about the philosophy of our practice. We are a collaborative midwifery model practice, which is based on the premise that pregnancy and birth are normal life processes. In the traditional midwifery practice, they typically care for low-risk, normal women. If they develop any abnormalities in their pregnancy, they may have to transfer out of midwife care in order to access physicians. In the collaborative model, though, you're able to stay in the care of the midwife. So you still have your conversations with the midwife. You can still labor and deliver with the midwife if you're going to deliver vaginally. And most of our labors and deliveries are attended by our certified nurse midwives. So I know some of you came in as my GYN patient, Dr. Marrow, Dr. Mooney's GYN patient, and you're like, oh, I'm going to just slide over here and have Dr. Adams deliver my baby too. Sometimes. Usually the midwives are the ones who attend vaginal deliveries. You typically only need a physician at your delivery if there is something wrong or abnormal, just outside of the midwife scope. So if there's something happening, your labor is going too long, your baby is misbehaving, not liking labor, they will call a physician consult to myself, Dr. Mayer, Dr. Mooney. We are always on backing up our own midwives. If it is something urgent, meaning can't wait until morning but wasn't scheduled, they will call us. We each live about 15, 20 minutes away from the hospital. We'll come in, take care of you and your baby. If it is emergent, as in cannot wait 15, 20 minutes, there are board certified OBGYNs who are in-house 24 hours a day, and our midwives will definitely use them. Now, to put it in perspective, in 2024, we're going to have to update with our new numbers, but in 2024, we did a little over 600 deliveries, and 4 times we called the hospitalist. And I will tell you the most common reason that we called the hospitalist was not actually even that something was wrong or abnormal, but because someone came in 10 centimeters, we didn't know they were coming in, and the hospitalist had to deliver them. So tell us when you're coming in so that we can avoid using the hospitalist for things like that. So, which hospital? Great question. We deliver at HCA Florida Hospital, which is over on University. It's less than 10 minutes from our office. And we moved there, for those of you who were with us, we moved there in 2023. And it's been a fantastic move for the practice, very supportive of our version of the midwifery model of care, in that the hospital has really adopted and taken to having midwives as well. In fact, they have their own group of midwives who will see you and be available as well 24 hours a day. And so we're very excited that they recognize the importance of collaborative care for obstetrics. If you've never been there, I recommend going to take a tour. So we do have quarterly stork tours, which are, I think the last one was in October, so maybe there's one coming up in February, but the dates are posted in each of the exam rooms. You can register for those. It's really cute. It's like a little baby shower. They take you in groups where you can walk through labor and delivery. You can meet the administrative staff. They raffle off prizes. It's a baby shower. Like, there's food. The doulas are there with their vendor tables. If those dates don't work for you, in between the stork tours, you can go to the HCA website and click on register for a class. And then one of the classes is labor and delivery tour. So you just pick one of those dates and you register, and twice a month, our childbirth educator will walk you around the facility in small groups. Office hours. Our office is open Monday through Thursday from 9 to 1. Then we close from 1 to 2 for lunch, which means the phones are rolled over. And then we reopen at 2 and close at 5 p.m. On Fridays, we close at 1 p.m. for the day. So if you're calling us between 1 and 2, between Monday and Thursday, you're going to get what sounds like the after hours line. The phone is not broken. The reason why we do that is because the after hours line rolls to the emergency on-call provider. So if you're having a medical emergency between 1 and 2, you'll still be able to reach the midwife who can help you. Please do not leave administrative messages on that voicemail, because she does not call and transfer those messages to the front desk. Just wait until 2 o'clock and you'll reach somebody at the front desk by pressing 0. If you need to change an appointment, make payments, that sort of thing. On Friday, if you're calling with something administrative and it's like 12:53 and right before it rolls over, then that issue may be addressed when we reopen on Monday at 9 a.m. We do not have walk-in appointment spaces. Our goal is to see you at as close to your appointment time as possible. So if I promise you the 10:40 appointment and someone else decides at 10:27 that they need to come in and be seen, their appointment is going to run into your 10:40 appointment, and that's not fair to you. You took off work, you got childcare, you drove across town to come in for your 10:40 appointment. So if there are openings, we have limited same-day appointments. Front desk is very good about, like, let's say you call at 9:30. Hey, I think I need to be seen for whatever this is. And it's something, yes, we agree you need to be seen, but there's no space right now. There's a spot at 11:40. Maybe you can come in and see Brianna or Jordan at that time. If it is something urgent, like you're calling at 9 a.m. and saying, I'm not really feeling my baby move, that's not something that can wait until 3 p.m. when we have an opening. So they might recommend that you are seen at an urgent care or on labor and delivery. That's not us saying we don't want to take care of you. It's us saying we agree this is something urgent and it shouldn't be sitting in our lobby waiting to get worked in for our visits. When you do call, the providers are not able to leave their appointments to take phone calls from patients, because again, I promise you the 11:20 spot, someone calls at 11:25 and says, I have a question about why my knee hurts. Like, again, that's not fair to you. You made your appointment at 11:20, you're getting my undivided attention unless there is a true emergency. When you do call, though, if you're not able to reach someone at the same time as you call, please leave a message, because we do check our messages and we will call you back. You have to make sure that you're leaving the message with the right person. So if you have something that's administrative about pregnancy, your paperwork for disability or forms, or if you have a triage call, having a little cramping, having some bleeding, think I might have a urinary tract infection, Sierra takes our nurse calls or our clinical calls. Sierra and Jennifer actually split those now. Our OB clinical coordinator is Naisha. So if you've been referred to see a specialist for something, cardiology, high risk OB, hematology, Naisha handles all of that coordinations. She also helps us to order labs and make sure that they're coming in from the lab as well. And at the end of pregnancy, Naisha is your point of contact for scheduling. So if you need an induction or a C-section or a version or even a circumcision for the baby, Naisha is the one who schedules things at the end. Most of you have already spoken with Renee, our benefits coordinator. So it's January, Happy New Year, and many of you have new insurance. So if it's something different than when Renee checked your benefits back in December, please, please, please contact her to let her know that things have changed so that she can update what your benefits are, or if there's anything that you don't understand about a new insurance plan. After hours, there is always someone from our practice on call for our practice. So when you call that emergency on call number, it's one of the full circle staff who you're going to reach. This is who you call if you think you need to go to the hospital. So again, you just call the regular number that you always dial, and it will tell you, hey, you reached the after hours line. You go through the prompts and you'll get the emergency on call person, but you have to leave a message in order to get a call back. So if you just call and hang up and call and hang up and say, no one ever called me back, that phone doesn't ring unless a message is left, because people pocket dial their gynecologist all the time. And we don't want to, at 3 o'clock in the morning, call somebody back who didn't mean to call us in the first place. The patient portal is a way to contact us, but remember, response times can take 2 business days. As soon as you hit send, a little alert pops up that says, please allow 48 hours, which I'm interpreting for you is 2 business days to respond. So if it's a non-action item, like, oh, I was just wondering whether I could take these vitamins. If we're seeing you soon in the office, that may be something that we pass to the person who's going to be seeing you at your next visit. The portal is best used for things that cannot wait for a visit, or that we've asked you to do and we can help you get done sooner. So if you lose your lab slip, you think you need to change your appointment from in person to virtual because you've got an upper respiratory infection, as long as you've got 2 business days between when you need this addressed, then the portal is a good place to do it. What we don't want to see on the portal are urgent matters, and people are still doing this. If your blood pressure is high, if you don't feel your baby move, if you are bleeding heavily, please don't send this information in a place where I have 2 business days to respond. That's something I need to know now. That's a phone call to the emergency on-call person. We ask that you don't send these as a blitz message, which is like making a big paragraph message and then cutting and pasting it to all 10 of us. That's abuse of the portal, and multiple messages to one or more of us makes it look like you're a bot, and we've seen it delete people's portal accounts from that, and they're really hard to get reinstated. So send one message. If 2 business days have gone by and you haven't heard from that person, you can either choose another person to send it to, or you can call, because again, if it is urgent and you cannot wait for a response, then we do want you to call. Someone very upset that she went to her pharmacy and there were 5 prescriptions waiting for her. You sent the message to 5 people, and we all want to help you. So, you want to use our time efficiently too. There are lots of patients and not as many of us. So all of us working on one person's thing can be confusing to you and doesn't help everybody else either. We ask also that you don't try to have an appointment via the portal. So this is if you're uploading a bunch of papers for us to review, asking us pros and cons of different treatments, look at these labs, see what you think. That's a visit. And we've done visits for 8 hours today, and then we reviewed all our labs, all of our ultrasounds, made phone calls if we had to. We want to spend some time with our families in the evening, please. So if you have something that is going to require a lot of back and forth, if we haven't specifically said, hey, I actually want to communicate this with you after your visit, start a text thread with yourself to text yourself questions or schedule an appointment. We'd be happy to see you and talk through all of those things during our regular business hours. If the other thing that we do over the portal is release your ultrasounds. So unless there's something urgently abnormal, we don't get the report same day. So if there's something urgently abnormal, we will not let you leave the building. Like Kathleen and Taylor will come and get us and say, hey, this doesn't look good. You really need to go and talk to them. So we will interrupt our schedule for urgently abnormal ultrasounds. Otherwise, they finish their reports. We upload them to our electronic medical record system, divide them among all of us, review them, and send them out to you within 2 business days. So if you know that your anxiety will not let you wait 2 business days to know what's on the ultrasound report, schedule a visit on the same day. The techs can print out a preliminary report and go and hand it off to the provider who's going to see you, and she can go over what you needed to know for today. Like if you're following my placenta was close to my cervix. Is it still close to my cervix? That's something you don't want to wait 2 business days to find out. Make an appointment to follow your ultrasound, and we can at least answer that for you on the same time. Otherwise, give us a chance to receive the report, review them, and send them out to the portal with our commentary. Quest, we're using less and less these days, yes, but they also have a portal and they will send the results to you before they send them to us. And y'all get these reports and they are full of read this and read that. And then you start Googling, and at the end of every Google search is cancer. And so then you start telling us, oh my gosh, this is awful. Red doesn't necessarily mean abnormal. Take a deep breath. Red doesn't necessarily mean abnormal because they are using reference ranges for people who are not pregnant. In pregnancy, there are some physiologic changes that make it okay for you to have a high this or a low that, and that's acceptable. So give us a chance to receive the labs from outside. Like, don't screenshot them and upload them to it. You don't have these yet. I need to know why my basophils are this. Give us a chance to receive them from Quest because that does help us close our order loop so we're not continuing to look for it if we've already gotten it. Give us a chance to get them, review them, and send them out to you with our commentary. If you've had your results for more than a week and you haven't heard anything from us, then do let us know that you did go to get them done. Tell us what date you went so we can look them up and again close our loop from our side. The most common reason, though, that we don't get results is if you're using 2 different names at different facilities. So if you are intending to change your name, oh, you've been meaning to do it. You've been a Smith your whole life, and now you met this wonderful Jones, and now you want to be a Jones too. That's awesome. Does your insurance company know that you're a Jones yet? And also the bank, and also, the driver's license and all the things. So please be the same person every place until everybody agrees that you've changed your name everywhere, because we don't have a fax machine here. Everything goes to an EMR processing in Massachusetts. They need your name and your date of birth. If you are Susie Smith here and you are Susie Jones there, that thing will not go into your chart and it won't associate with you. So alternative name use guarantees delays. Our front desk gets it and they sort through and try to figure it out by date of birth later, but I can guarantee you that does cause a delay. Any questions about how to reach us, how to best communicate with us? All right, let's talk about what to expect at your prenatal visits. So first thing to expect is that you are going to forget everything that you've been meaning to ask for the last several weeks. So start a text thread with yourself. I love it when I have visits and at the end I'm like, hey, did you have anything you wanted to ask me? And you're like, oh, wait, let me look. And pull out your little text thread. Wear loose, comfortable clothing so that we can access your belly. At every visit, we're going to be listening to the baby's heartbeat, not doing an ultrasound, but using the Doppler to hear the baby's heartbeat to know that it's okay. So we'd like for you to get here about 5 minutes before your scheduled appointments. You'll have time to hang out at the front desk, do your check-in and insurance thing. And if you need to leave a urine sample, you'll have time to do that. Everybody does not have to routinely leave a urine sample. We used to do that back in the day, and ACOG, the American College of Obstetricians, says we no longer need to. If we are following your blood pressures and we're looking for protein in your urine, or following your blood sugars and we're looking for glucose in your urine, or you had a recent urinary tract infection, those are times that we're going to, and we'll tell you, we need a urine sample from you today. Otherwise, we know you're pregnant, you've been driving, you've been drinking your water. Hopefully you've been drinking your water. You need to go to the bathroom. So come on in, use the restroom so that you'll be ready at your appointment time to see your midwife. If you are 10 minutes late, we will still have time to check on you and your baby, but it leaves less time for our little text thread of questions here. If you're 20 minutes late, you've missed the entire appointment slot, and if we're able to, we'll work you in later in the day if somebody has an opening in their schedule. But if that time doesn't work for you, then we'll get you rescheduled to a day that works well for everybody. When are you going to have another ultrasound? I know that's what you were wondering. So diagnostic ultrasounds are separate from your prenatal visit. Okay. So every prenatal visit, remember, is not an ultrasound. The way to know if you have an ultrasound scheduled is to look in your portal and see, do you have more than one appointment time? And is there a provider's name associated with your visit? So this is my imaginary patient, Tina Test. And Tina logs into her portal and she clicks on appointments. And when she does, Tina sees that she has 2 appointments on the same day. The first one is at 9:20 with ultrasound, which is not a provider's name. And then Tina has an appointment at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she can bring her family in to hang with her and see the baby at 9:20. And then the tech can print out a preliminary report before she goes to see Dr. Yeckel, where she can go over that and have her prenatal visit. If you think you're supposed to have an ultrasound and you don't see it on the portal, definitely reach out to front desk and find out whether that is the case. Once she has that, if she does not have an appointment with a provider the same day, she'll get a report within 2 business days on the portal, unless there's something urgently abnormal, in which case we will find one of the providers who will come and talk to you, make a plan for what we saw on the ultrasound, and go over it with you in real time. So when you're checking out of your visit for 16, 17 weeks and your midwife says, hey, it's time for your anatomy ultrasound, be sure when you go to front desk that you have 2 appointment slots scheduled, not just the prenatal visit, but also a diagnostic ultrasound when that is due. Now, if you're saying, hey, Bree, I really want to look at my baby more, but you don't need a diagnosis, you go to a boutique ultrasound place. So these are little cutesy places around town. I just list them for informational purposes, not endorsing anyone over another, but depending on where you are in the city, these places do fun ultrasounds. They do 3D. They'll put the baby's heartbeat in a little stuffed animal. Super cute. But these are safe, and you can do them as many times and as often as you want. Have your whole family in there with you, but you do not need a medical reason to get a boutique ultrasound. All right, so we are going to talk about ultrasounds. When should you expect routine diagnostic ultrasounds? Are you going to get them at every visit? Do you get them at 20 weeks, your due date, and past 41? Or do you only get ultrasounds if you have a problem? And the poll is closing in 5, 4, 3, 2, 1, done. All right, so the last person snuck in there with it at every visit. No, we are not doing ultrasounds at every visit. Your anatomy ultrasound is right around 20 weeks. And if we see everything we need to see there and you don't develop any other issues with the pregnancy, then your next ultrasound would be if you go past your due date, okay? So most of you got that one right. 20 weeks, 40 weeks, and 41 plus weeks. Awesome. All right, we are going to slide over to Full Circle Jacks. Let me know if you're able to see the website. Give me a thumbs up or a heart or whatever. And if you're still seeing, okay, very good. Okay, fullcirclejacks.com. The next portion of the webinar is going to go through this website to give you lots of resources. So let's start with the providers. So these are the lucky people who will get to be in the room when you grow your family. Super cool. I have the best job, I think. So there's me, there's my partner, Dr. Marrow, our partner, Dr. Yeckel, and our partner, Dr. Mooney. And then we have the midwives. There's midwife Lauren, midwife Krista, midwife Cindy. Vanessa's a PA. I'll come back to her. Midwife Norma, midwife Kayla, midwife Jordan, midwife Brianna, and midwife Jackie. So if you're planning a vaginal delivery, the midwives, like I said, are more likely to be there for you. If you know you're having a belly birth, which is our name for a cesarean, for whatever reason, Vanessa is our PA, and most of your visits will be with her because she does scrub into some of our scheduled cases to give you that continuity because the midwives are not expected to be at your delivery. So there's more information on each of us on there. Find out, get to know our team, and see if you have stuff in common with us, because as much as we're going to know about you, you should know a little something about us. Over here under patient information, you will see the obstetrics tab. And so a lot of good info. You'll know you're in the right place. You'll see the growing bellies and then the baby here on the end. Our delivery stats. Let me see if we've updated these for the year. We haven't. Okay, so our delivery stats are out here back to 2018, I think. And so many of you are here because of our statistics. We're very transparent with our numbers, essentially. What are your chances of getting a C-section here? If you've had a previous C-section, what are your chances of a successful vaginal delivery after that? So feel free to take a look, and we'll be adding the 2025 numbers in there soon. All right, let's go through what to expect at each visit. So the prenatal care timeline. This is, again, you can find this on the website, tells you what to expect at each visit. So I'll be updating some of this soon, but you'll get the gist of it today. So everyone on here has had their confirmation visit, which we like to do between 8 and 10 weeks, which consists of a dating ultrasound, meeting with a midwife to go over that, and then ordering or at least discussing some initial blood work. If you don't get your blood work done on that day, you might have your blood draw scheduled after you see me. So usually after your 8 to 10 week confirmation, you have a virtual visit with me where I go through your medical history, your family's genetic history, all that good stuff. And we decide whether all you need are the regular standard prenatal labs, or is there something about your medical history where we need more blood work? And if so, then our goal is to get you back into the office to get all of that blood work done in your first trimester. If you choose to do genetic testing, the NIPT or carrier screening, which you go over what that means with when you see me, you have to be at least 10 weeks to get that done. So if you're more than 10 weeks when you do your confirmation and you already know you want it, the midwife might have you do it the same day. If you're not, they might have you wait until after you see me. At this point in pregnancy, we are seeing you in person every 4 weeks. So roughly 4 weeks after your confirmation is when you come back for your physical exam. And the physical is just like it sounds. It's a physical exam. We do your heart, we listen to your lungs, we do a breast exam. There's a pelvic exam that is not necessarily a speculum exam. So speculum exam is what we use when we need to do a Pap test. The Pap test is not part of your standard prenatal blood work because they're done every 3 years. If you're due for a Pap, you're welcome to get one done during that time, but it's not required because it's not part of the standard prenatals. What is part of the standard prenatal labs is cervical cultures, which if you'd like to avoid pelvic exam, you can collect cervical cultures on a self swab. Those of you with any high risk issues, after you see me for your history visit, I will typically initiate a referral to the high risk doctors. Then about 4 weeks later, you're back in the office for us to do a second trimester belly check. This is when you start feeling the baby move, maybe some round ligament pain. So we start talking about different things to expect at this point in pregnancy. It's a pretty relaxed visit. Then around 20 weeks is, as we said, it's time for the anatomy ultrasound, where we look at the baby's brain and kidneys and heart and all of that good stuff. And if the baby is cooperative, this would be your time to find out if it's a boy or girl if you didn't do the genetic testing that tells you before. If you're meeting with a midwife around this time, we'll also be doing mental health screening. So for anyone who has any history of depression or anxiety, there's a lot of attention to postpartum depression, postpartum anxiety, or rage. A lot of these things have warning signs that start during pregnancy. And as a holistic practice, we treat the whole person throughout the whole pregnancy. So if you see us start screening, whether you've had an issue before or not, it doesn't mean we're singling you out. Literally everybody gets screened because you never know who's going to be the person who develops it. So we start our screening early with mental health. Your anatomy ultrasound, and then the midwives will start giving you information on childbirth education or breastfeeding classes. About 4 weeks later is the glucose test, which I know you'll have questions about that. Hang on, I'm going to get to that in just a moment. If you have a certain blood type, we're double checking to make sure whether or not you need RhoGAM to protect future pregnancies. This is around the time when we'll be giving you the information to pre-register at the hospital. For those of you who were with us at Ascension before, it was papers you filled out and mailed into the abyss. Now everything is online. So we'll give you the information to pre-register at the hospital. This is when you want to schedule your hospital tour. And if you haven't already selected your doula, you want to have her finalized by the end of your second trimester. Now we're moving into third trimester, and so we start seeing you every 2 weeks. So it starts to ramp up. If you're planning on getting your vaccine boosters, this is the time to do that. So we're in cold and flu season until March. So this will be protective. You'll have enough time to make antibodies to protect your baby against community flu. RSV, COVID, Tdap, all those things. Your midwives will go over all those with you. We do not give them in the office, but if you want to get them, we will give you the prescription prescription and tell you where to go and have that done. You'll see here in the middle the option to repeat or decline your standard prenatal labs. So this includes your STI screening. If you feel that you are in a low risk population to contract an STI during pregnancy, you can opt out of doing this with a form that we have. Otherwise, that will be something that we have you draw or get drawn when you're here at your appointment. Then we start the every 2 week visits around 30 to 32 weeks. So moms who have certain pregnancy complications like high blood pressure or high blood sugars may start additional testing with us also. And moms who are expecting to have a belly birth for whatever reason, typically we'll start getting your date together when you're right around 32 to 33 weeks so you can start planning that. Every 2 week visits continue until 36 weeks, and then it ramps up even more. And we start seeing you weekly. So at 36 weeks, we do one more pelvic exam to collect a group beta strep culture, and we'll tell you what that is and why it's important before we do anything. And if you have opted out of repeat STD screening, you've opted out of repeating STD screening, and that's fine. So, but now we start weekly appointments. So full term is 37 weeks, actually. Your due date is 40 weeks, but full term is 37 weeks. So now let's start talking birth plan. So I'm gonna show you where our template is for the birth plan. You're gonna start your natural cervical ripening methods. For my belly birth moms, everyone's typically off the train by 39 weeks because we usually do those from full term at 37 to 39. And then if you're going past your due date, like waiting for this baby to give the signal to start labor, be patient. All passengers are out by 42 weeks. So for first-time moms, we let you go to 41 weeks and 5 days. For veteran moms, 41 weeks and 6 days. Because your average length of labor, first-time moms, is about 24 hours. 24 full hours. Second-time moms, usually whatever your first labor was, it's about half of what that is. And for first-time moms, those contractions that start up but don't change your cervix yet, those don't count as part of your 24 hours, but roughly 24, just so you know what to expect when that happens. And many of you have never been up for 24 straight hours, and so it feels like a lot longer, but just know you heard it here first. All right, now another poll question. If you had a headache, are you more likely to meditate, take a Tylenol, or go to the emergency room? And the polls are closing in 5, 4, 3, 2, 1. All right. So, oh my gosh, somebody actually said emergency room. People almost never pick that. Okay. Well, I certainly hope that you don't need to go to the emergency room for a headache. But we have more meditators than medicators today. And Tylenol is fine if that is what you need to take for your headache. So, some of you are concerned, oh my gosh, I can't take anything because I'm pregnant. Not true. Here is a list of safe medications in pregnancy. So this has an alphabetical list of common discomforts and symptoms in pregnancy. In the middle, you'll see the things that your midwife is going to recommend that you try first. So if you send a message, and some of y'all have already found this out about me, Dr. Adams, I'm constipated. What can I do? And the first thing I'll say is, hey, have you tried everything on this list? And I send you the link to this list because, and some of y'all are getting smart. Oh, Dr. A, I've already tried everything on the list. What can I do about this heartburn or reflux? Okay. All right, now we're talking. So then after you've exhausted everything on the list, then definitely reach out to us because maybe time for evaluation for it. It might not be what you thought it was. It's not nausea, it's heartburn. Or it might be time for something prescription. So a couple of pages of all of this. Be sure you take a look at this first. You can print it out. You can download it to your phone because I promise every time you need it is 3 o'clock in the morning. The next box here is our gestational diabetes. I'm not going to get into it right now. I promised you a talk on it in just a moment. But I did want you to see that this is here for when I reference it later on. These are instructions on what to do when it's time to take the diabetes test. Weight gain in pregnancy. All right, so many are concerned that I don't have an appetite, I'm not eating, I'm even losing weight during first trimester. Don't sweat it. There's a link right here. You're going to put it in your height and your weight, your pre-pregnancy weight, and it'll give you your pre-pregnancy body mass index. Based on that, it tells you how much weight you should gain in pregnancy, but more importantly, the rates of weight gain are in your second and third trimester per week. So if you're not gaining weight in your first trimester, don't sweat it. If you gain 20 pounds in your first trimester, maybe sweat it a little. But yes, you want to look at your overall weight gain. And if you have twins, you can add 10 pounds onto the upper limit of each one of these numbers. So keep in mind that this information is out there if you're starting to worry about how much weight is normal to gain during pregnancy. The next box we're going to take a look at are our birth preferences. So the birth preferences, this is our version of the birth plan. So a lot of first-time moms here, and you've never done this before. So you're like, well, how do I even plan? I don't even know what this looks like. So this kind of breaks it down, little bite-sized pieces, everything from how you want labor to start. What do you want to wear in labor? Like, do hospital gowns freak you out? Don't wear the hospital gown. Monitoring what you want to do for the discomforts of labor. And I'm happy to announce that the nitrous has a policy. So we do have nitrous just like in the dental office to help with pain relief. We also have tubs for labor, and obviously we have IV pain meds and epidurals. But the main thing I want to highlight is we're not strapping you to the bed and starving you, because labor is a marathon, and you need to have adequate hydration and nourishment for that. You can labor in any position, push in any position, deliver in any position. Our standard is immediate skin to skin, delayed cord clamping, all that stuff. If you have specific things that you want, like if you're doing cord blood banking, let us know so we can, work out how to balance that for you. These are the traditional medications that are offered to the newborn after delivery. Talk to your midwife about whether this applies to you. Is this something you want? What's the process for if you don't want it? All of these different things. So this is 21 boxes, and most of you, all of these boxes don't apply to all of you. Like, you're not all expecting baby births or belly births or twins rather, or having a son. So you may not be looking at circumcision, but one box per week is usually a very decent pace to, at the end, when you're like 36, 37 weeks, start talking to your midwife about, all right, let's go through this. Do these things apply to me? All right. Next, cervical ripening techniques. So after the 37-week mark, you'll see that we kind of ramp up with different things. And all of this is from evidence-based birth. So different things that can help your uterus to contract and thin out your cervix in the weeks leading up to labor. Your baby still has to give the signal to say it's time for labor to start. But this just kind of helps your body to be ready for when that happens. And you can read week by week what those things are. All right, do I have any moms on here who had a belly birth before and are looking to have a vaginal delivery this time? Most of you are first-time moms, so that will not apply. But there are only two choices. Either it doesn't apply or you're going to rock it. All right, and the polls are closed. Excellent. Okay, cool. Oh my gosh. So it looks like really almost all of the veteran moms have had C-sections before and are looking for a VBAC. All right, cool. Good to know. Which means everyone should be listening to this next part. First-time moms, and trial of labor after cesarean moms. These are our recommendations. Many of you know that I, Dr. Marrow, and midwife Lauren are all VBAC moms, vaginal birth after cesarean. And so we are not just a VBAC tolerant practice. We are a pro VBAC practice. We want you to win, sis. So babies are going to baby. You cannot control that, but we want you to control what you can. And these are ways to reduce conversion to cesarean. First-time moms, listen up. The most common reason we are doing C-sections these days are not because babies are too big or babies are in distress. It is because babies are in the wrong position, crooked little heads. The head is down. That's only half the battle. The head has to be down with the face facing your back. Very important. A first-time mom who comes in with the back facing your back, even if the head is down, your delivery rate is about 5% vaginally. 5%. So, having said that, practicing yoga, doing daily squats. We're going to talk about squats in a moment. Working with a doula. Talk about doulas too. Not getting exhausted and deciding, just get this baby out of me. So don't be induced unless there's a medical reason. And then trust us. Like, we don't want to push you into interventions that mess up our stats and increase our C-section rate when it's not necessary. We do necessary C-sections over here. Okay. So remember, this is out here, and help us help you. And lastly, circumcisions. If you're having a son and you want to have him circumcised, we do require vitamin K injections. And this is information on how to take care of it afterward. We do them in the office before he is 10 days old or when he is 10 days old. All right, so fullcirclejacks.com, pregnancy information, obstetrics, all of this is available for you to take a look at. And we are headed back to our presentation. So let me know if you are able to see this mocha monstrosity coffee or whatever. So those who are concerned, oh my gosh, Dr. Adams, I've already gained 10 pounds and all I'm drinking in the morning is coffee. Is it coffee or is it one of these things? Because it is not the same thing. Here is my first question of the day. I'm so excited. Did you say there is a chance to deliver with someone not from Full Circle? Yes, that is if you have a true emergency and no one from Full Circle can get there before you need to be delivered. That's the only time that really happens. And again, as you saw from our stats, 4 out of 600 people did that. And again, it was not because something was wrong with their baby, but their labor just went faster than they expected. 2 of them were in the lobby. Please don't do that. Don't deliver in the lobby. We have beautiful suites upstairs that we would like for you to have a baby. Anyway, did you know pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain 1 pound of body weight, and your pregnancy goal weight gain, remember, is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 net calories to maintain that. If you're looking to gain 25 pounds during the pregnancy, you get 250 additional calories for a total of 1950. Divide that between breakfast, lunch, and dinner, and we're looking at 650 calories per meal. Now, if you eat 650 calories, you can't then drink 570 calories in your mocha coffee monstrosity because your baby doesn't know the difference. You're going to get to keep all those extra pounds, and happy Mother's Day. It's hard to get rid of those at the end. This little busy slide here kind of goes over where those calories should be coming from. And just remembering what things to limit, how to get your protein and your fat and keep and your carbohydrates and keep those in reasonable amounts. The second part of it is kind of just how little changes can help. So if you are taking spaghetti sauce, 550 milligrams of sodium, versus 20-minute herb-infused marinara, which still tastes really good, you can eliminate 500 milligrams of sodium from that serving. Super easy change. Other things that we should be looking to eat. I see a question here. What does transitioning out of the tub look like if you're only able to labor in it? It looks different for different people. For some people, when they say, oh, I'm starting to feel pressure, we say, all right, let's have you, get out of the tub. You can still, squat or kneel or get on all fours or however you want to deliver outside of the tub. Or if you're saying, oh my gosh, I really can't, then we have a rapid release of the tub that we can pump the water out of it so that you're not delivering under the water. Next, you can eat fruits, veggies, whole grain, cereal. If you're not going to give your baby a nut or dairy allergy if you eat those things during pregnancy, so enjoy. For my coffee drinkers, just remember American Pregnancy Association recommends limiting your caffeine to 200 milligrams per day. Remember that caffeine is a diuretic, so I recommend on top of that 3 times as much water as caffeinated beverage in order to stay hydrated. Herbal teas are fine. Some of our favorites in pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my vegetarians, pescatarians, you want to still make sure that you're getting 70 grams of protein per day. There are some birth classes out there that tell you to try to eat over 100 grams of protein per day. Do so at your own risk. You will probably grow a 10 or 11 pound baby. 70 grams is your sweet spot. Please, again, help us help you. 70 grams is enough to support a healthy pregnancy and to not have your baby be, super scrawny and growth restricted. You can have deli meat. Just be sure you're microwaving it for 30 seconds first to kill any harmful bacteria. It does not have to be scalding hot when you take it out. Don't burn your mouth, but just make sure you get your 30 seconds in to kill any harmful bacteria. If your soft cheese is made with pasteurized milk, it is safe. If you are at a restaurant and you cannot verify whether your soft cheese is made with pasteurized milk, consider it unsafe. So just flip it over. Trader Joe's, Publix. If you see pasteurized milk, you're good. You can have canned tuna, up to 3 4-ounce cans per week. If you're pescatarian and you want to know what other fish are okay to eat, the FDA has a great document out there. It says October 2021. That is the latest iteration of it as of last week. I'll check again this week. But fish that you should eat in larger amounts because they're high in DHA, which is good for baby's brain development. Fish you should eat in moderation because they're neither plus nor minus, and fish you should avoid because of high methylmercury content. Another question I have here, what if in the first trimester all you can tolerate is fruits? Do the best you can. Fruits are like the first trimester is survival mode. That's why we don't measure what you gain or lose until second or third trimester, because that's when typically your food aversions go away. If you're craving something in first trimester, it's typically like it can be a sign of a deficiency. So you may be lower in vitamin C and your body is saying, okay, well then eat this citrus. That's all we're going to let you keep down right now. So listen to your body, do what you can. Don't beat yourself up about it. And second trimester is when you can do some parenting and make your baby eat more vegetables. Pregnancy nutrition. You want to make sure that your meats and fish are cooked all the way through. For my kombucha for my kombucha drinkers, kimchi eaters, you want and sauerkraut as well. Those can be prepared like with fermentation, which your body can treat as an alcohol. So you want to limit the intake of those. Alcohol specifically, we don't have an amount that we know is safe for everyone. So we say avoid it altogether. And you want to limit your sodium intake to less than 1,500 milligrams per day. When you start flipping food over and seeing how much sodium is in it, it is appalling. In the third trimester, when your rings stop fitting, this is why. It's why. Any questions about food before we move on to exercise? All right, cool. Exercise in pregnancy. Please exercise in pregnancy. It is okay to continue whatever you were doing for your pre-pregnancy activity unless what you were doing was nothing. You just don't feel like it in your first trimester, and I get it. But second trimester, though, you're going to increase your blood volume. Other physiologic changes are going to accommodate more aerobic activity. So just listen to your body, take it slow, ramp back up when you start feeling low enough to go back to the gym or your home workouts or whatever. Question I have out here is it safe for vegetarian to have any additional protein powder or supplement as long as you are not going over 70 grams, like excessively and consistently? Yes, those are just fine. And watch the carbohydrate content in them as well. If you weren't doing anything before, and you want to start something new to be healthy and make sure your baby gets in a good position, it's fine to start a new regimen. Doesn't have to be anything crazy. It could just be walking. We'll talk about walking in a moment. Just remember, a sedentary lifestyle, however we're sitting with our phones and bent over and slumped down, is causing all these babies to curl in sunny side up. It leads to malposition babies, which leads to you meeting me for a belly birth. That's not how I want to meet you. For those of you with these cute little Fitbit watches that you're monitoring your heart rate all the time, your resting heart rate will go up by 10 to 20 beats per minute. And that is normal. It's physiologic. If it's not making you dizzy, you're not passing out from it, don't sweat it. That's normal. I have a question out here about recommendations to strengthen pelvic floor. I'm going to get to that in a moment because we're going to talk about pelvic floor therapy a little later on. Okay. So if you're walking, you want your heart rate to be in the aerobic zone, which is 70% of your maximum heart rate calculated by your age. So let's say you're 30 years old. You start with the number 220 and subtract your age. So you should not be exercising with your heart rate above 190 for extended periods of time if you are 30. 70% of that, though, is where your aerobic zone starts, 30-year-old. So at 133. So when you're walking, if your heart rate is between 133 and 190 sustained for 30 minutes, that's aerobic exercise. If when you're walking, your heart rate is still hanging out between 80 and 100, like it always is, that's transportation. And transportation is important, but it is not exercise. So this is your exercise goal, to say that you are actually giving your baby lots of good oxygen, nutrients, and all the things. So cardio, you can treadmill, you can elliptical, run, swim. Swimming is amazing. Like when it starts warming back up, lets your belly be weightless and your joints are more fluid. Indoor bikes, if you're a Peloton person, Off My Meds 8 is my tag. Follow me, I'll follow back. You can weight lift up to whatever you were lifting prior to pregnancy. You don't need to increase your resistance during pregnancy because your baby and your body are going to be increasing that resistance for you. Squats are my favorite. So you're building up to a minimum of 50 squats per day. If you're already squatting and doing more than that, go for it. Continue. If you're not an experienced squatter, at 20 weeks, you're going to give me 5 a day. 21 weeks, you're giving me 10 a day. 22 weeks, you're giving me 15. Building up again to a minimum of 50, and they don't have to be all at the same time. Sometimes I will do a prenatal visit with you and we will squat together and you'll say, oh my gosh, I didn't know there was going to be a quiz. Sometimes there's a quiz. Pilates and yoga are also two of my favorite pregnancy exercises, and any experienced instructor will be able to tell you what the pregnancy modifications are. The things you want to watch out for: high intensity exercises like the HIIT, high intensity interval. It's not the interval. The interval is fine. It's the intensity. You can do the low impact version of these exercises after first trimester. Anything that has you lying flat on your back for a long period of time, like excessive ab work. Standing abs are fine, side lying abs are fine, just not on your back and crunching. Hot yoga, unless you're a hot yoga instructor and you are fully acclimated to the environment, you're going to get dizzy during pregnancy and possibly fall, and you don't want you to fall on your belly. Avoid scuba because rapid changes in barometric pressure are not great for baby's oxygenation. Same thing with high altitude hiking. You can visit high altitude. So you have family in Colorado, need to go see them 8 to 10,000 feet above sea level. Go for it. Just don't go hiking with them because your increased oxygen requirement is not enough for you and baby. Please limit contact sports. We've had some weird pickleball incidents recently. Also, this is not the time to start kickboxing. Outdoor biking after 16 weeks is not a no, it's just a be careful. So 16 weeks is when your center of gravity starts changing. And as you go to turn that bike around the corner, we've had a lot more people kind of just fall over because they didn't expect that they were putting that much sideways weight on the bicycle. Question I have here is, if I had a C-section before, can I squat? Yes, absolutely. Still good for baby's position. I know and remember you, we're planning a belly birth, but squats are still good to make you feel good. All right, and then next, can we play volleyball as long as we don't dive for the ball? I mean, yes, but any sport with a ball flying at your belly, just, I promise, like y'all are like ball magnets. Just if there's anything that can hit you, it definitely does. So, if you like, it's not a no, but it's a, God, please be careful. All right. Now I have a poll question because I have gone through all the things about exercise and nutrition. So now that I've done that, you tell me, can you prevent gestational diabetes with just diet and exercise? I have a lot of first-time moms here today, so y'all don't know my tricks. All right. And the polls are closing in 5, 4, 3, 2, 1, done. All right. Oh, pretty even there. Okay. The answer is no, and I'm so excited that there are so many more of you who know that the answer is no. And I'll tell you why. It is, how you blame your hormones for like everything all the time? Girl, same. So the placenta actually gives off hormones that tell your insulin not to do its job. It's called insulin resistance. And so your insulin has the job of clearing the glucose from your bloodstream. If your placenta is out there saying, hey, insulin, take the day off, guess what? You're going to have lots of extra glucose hanging out in your bloodstream. Extra glucose in your bloodstream is, that's right, diabetes. But it's gestational diabetes because your placenta is the main character behind all of this. So if you can do this pregnancy without a placenta, then I don't need to test you for gestational diabetes. But every single one of you has a placenta. I know you do. And some of you have two. You have twins in there. So my moms who say, but I never eat anything with sugar in it. You eat good carbohydrates. You eat your fruits and your whole grains. Don't avoid those leading up to the test because you're going to give yourself a false positive, which is really miserable. If it's the drink itself that gives you pause, we have lots of options. Remember on the website where I said, I'm not going to go through this now, but this tells you the steps before you take your glucose test. Patient-driven options are out there. We have for sale here in the office Simply Pure Drink. We may actually be stocking the Fresh Test drink soon. I'm not sure. Like, we're still looking at wholesale options. But the Simply Pure that we have is soy-free, it's dye-free, it's gluten-free, it's BDO-free, it's kosher, it's vegan, it's offensive to almost no one. It's just glucose. And so you can take that and not have to worry about any of the additives that give you trouble. And so this is right around 24 to 26 weeks. If you're going to be ordering one of the other drinks, let your midwife know, because some of the commercial labs don't accept outside drinks, and we can make arrangements for you to do your testing here with us. All right, so preparing for birth. Some of you are planning unmedicated deliveries. And for childbirth education classes, again, these are for informational purposes, but represented on here are things like Lamaze, Bradley method, hypnobirthing, hypnobabies. So start your search here, and you know how the internet is. Once you start searching for this, all of your social medias are going to say, "Oh my gosh, are you looking for birth classes?" And so things are going to pop out of nowhere. Breastfeeding classes, La Leche League does have them all over the place. Also, HCA has an amazing lactation consultant, Sonia, who will walk you through what to expect with breastfeeding, give you tips and tricks ahead of time. Every new parent should know CPR. So even if you already know adult CPR, this is a great time to do a refresher and learn and tack on infant CPR. So there's a link to the Red Cross to sign up for a class prior to the arrival of your little one. If you're already seeing a chiropractor, amazing, because this is really good for helping getting your pelvis and your back aligned, because when that happens, guess what? Your baby descends in the right position. Can you tell that I'm obsessive about baby position? All right. I have another poll question. How many of you are planning to work with a doula? I know some of you I talked to and you already have your doula lined up, and some of you may not know what a doula is, and that's why I'm here. All right, polls are closing. 5, 4, 3, 2, 1, done. Okay, so cool. More people than not are planning to work with a doula this time. So let's talk about why doulas are important, because you're like, but I have a midwife. Why do I need a doula too? Doulas are there for emotional and physical support before and after and during pregnancy. So breathing techniques, changing position, getting into relaxation strategies. So it's not really just not just if you want an unmedicated delivery, but just again, pregnant, like labor is a safari. This a doula is your safari guide. So she's like walking you through it because this is what she loves doing, just showing up to people's labors and helping them be okay in them. They're not giving you medical advice. They are helping you process your feelings about the medical advice that we, your medical team, are giving you. So they're not providing medical care. They're not prescribing anything, and they're not delivering your baby unless you're doing it in the lobby or in your car on the way to the hospital. So please don't do that, because your doulas don't want to deliver your baby at all. The best doulas will like come to your house when labor starts. They stay with you by your bedside. So your midwife is at the hospital, but midwives change every 12 hours, unless it's the weekend, then we have longer shifts. But your midwife changes, your nurse changes, your doula stays with you. Your midwife may have 3 patients in labor at the same time. Your doula has you. That is your team. So ask the midwives for the doulas who we've seen come and really, stand there in the gap for our patients. They have recommendations for who we like working with. Acupuncture and pregnancy massage are definitely recommended. A lot of places won't do the massage in the first trimester, and some of them want a note for after the first trimester. So just let us know. We have a filled note that we can give them on the benefits of massage. Acupuncture is also great for first trimester nausea and for pain. And there's even baby come out treatments that you can do at the end. So acupuncture really throughout pregnancy is great. When you come out of the bathrooms up front, there are business cards on the walls for people who do pregnancy acupuncture and massage. I have a couple questions here. Does insurance cover doulas? Some do, most do not. We do have a letter that if your insurance company says, hey, if your doctor gives you a letter, then we'll, contribute something, but a lot of them don't. And the next question is, when should we begin searching for a doula if we choose to get one? Really, beginning of your second trimester is a good time, because you want to meet with them, like go have lunch, find out, like, does her voice annoy you? You don't want to be in labor with somebody with an annoying voice to you. And so you want to, kind of establish a rapport before you get to the whole labor part. So that's a good time to start looking. Great questions. Many of your insurances will cover breast pumps, though. We have QR codes in the exam rooms. So right around 20 weeks, right around the time you're doing your anatomy ultrasound is a good time to scan it. Please don't feel the need to reach out to your insurance company or look for other intermediary companies that send you all sorts of forms for us to fill out. They ask a lot of unnecessary information and waste a lot of your time. and hours. This company, we get no kickbacks from them except for the fact that they save us a lot of time. Scan the QR code, put your insurance info in. They will send you a list of what breast pumps they cover. You just check off what you want. They write the prescription and send it to us. We just sign our name to it, and boom, you have your breast pump in like 2 weeks. So 20 weeks is a great time to get that going. Many of you or your spouses will be using the Family Medical Leave Act to take time off when the baby is born, or you'll need intermittent leave to come to all the appointments that you have. We are using Leave Guru, which is a third-party vendor. Most of these forms, if you ever try to get them filled out before, it can take weeks sometimes for someone to go through your chart and fill out all the stuff. People are getting their forms in 24 hours, if not 10 minutes. So Sierra is the one who will walk you through getting signed up to get onto Leave Guru. And then after you deliver, there is postpartum care. So for my moms who have any blood pressure issues during pregnancy, please know, for first-time moms, there will be about 8 to 12% of you who have never had a blood pressure issue before, never, ever, ever in your life. And you will develop one out of nowhere because of hormones given off by the placenta. The placenta is a good guy, but sometimes it's the supervillain in this story. So if your blood pressure starts going up toward the end, just know this happens. It's okay. It's why you have a medical team. If you develop any blood pressure issues during pregnancy, we see you back a little sooner afterward because preeclampsia, which is what we're worried about, your most dangerous time for preeclampsia is in the 14 days after your baby delivers. Blood pressures, it's not prenatal preeclampsia. After baby is out is when your hormones are more concentrated and likely to kick up problems. If you had a belly birth, you come back for your incision check at the 1 to 2 week mark. Routine mental health screens. Again, remember, we're back. Postpartum depression, anxiety, rage. We want to get ahead of it. We really do. Because again, first time moms, everything seems abnormal. It's really hard to tell what is right and what is not. That's what we're here for. We've seen this thousands of times. We know what is normal postpartum adjustment, and we want to help you. We don't want you to suffer when you finally got your sweet little baby home. Postpartum doulas are a thing. So these are angel people who come to your house and do night feedings so that you can sleep for a fee. Let us know if you're interested in postpartum doulas, and we can direct you to their businesses outside of here. For anyone who we do identify as at risk for postpartum depression or anxiety, the Motherhood Space, Jacksonville is one of like 5 cities in the country that received a grant to really take care of moms during postpartum. Counselors, yoga therapy, light therapy, exercise therapy at the Winston YMCA downtown with childcare for babies 6 weeks to 12 years old. So really, moms, this is an amazing resource. We heavily refer here as well. Pelvic floor therapy. I had a question earlier. How do we strengthen our pelvic floor ahead of time? Really, you want to stretch your pelvic floor ahead of time. Unless you are leaking urine or having pain, I don't recommend strengthening exercises during pregnancy. We regain strength after pregnancy with pelvic floor therapy. And we actually have a nurse who comes in here 3 times a week and does pelvic floor rehab all day long. And that is standard in many countries. The USA, we're trying to catch up. But typically we start at 8 weeks after delivery. It helps with painful intercourse, leaking urine, laceration repair, and any of that stuff. Pelvic floor therapy addresses a lot of it, and it is a routine part of your care here. Renee Hall has already checked your insurance benefits for it. Random frequently asked questions. You can sleep on your left side, your right side, or your back. Yes, you can sleep on your back. If sleeping on your back makes you dizzy, though, get one of those wedge pillows that goes under your hip and just kind of keeps you from rolling completely flat. You can help paint the nursery. As long as you're in a well-ventilated space wearing your mask. You can take probiotics, prebiotics. I understand there are postbiotics now. Have at it. Enjoy. You can dye your hair, including your eyebrows. You can do gel nails. If you're in a salon where there's lots of fumes, consider wearing a mask so that you don't get dizzy and lightheaded and pass out. Car travel. You can travel up to 37 weeks. It's not dangerous to travel after 37 weeks, just your full term then, because your baby doesn't have a calendar. So if you decide, they decide it's labor time and you're not here, you're not going to have a full circle birth. And I'm so sorry for you if that happens. So please stay here after 37 weeks. Be sure, though, if you're traveling, get out and stretch every couple of hours. And if you're drinking enough water, you definitely will do that. Skincare, you can use your salicylic acid, benzoyl peroxide, just nothing that has retinol in it. Bakuchiol is Bakuchiol. It's a natural derivative of vitamin A that is not harmful to the baby. So if you need an alternate to retinol, that is out there. Flying is safe for twins up to 32 weeks, obviously with no other preterm labor issues. Same thing for singletons up to 36 weeks. Be sure you are wearing your compression hose, medium compression hose up to the knee, and doing toe raises in the seat to keep your blood circulating and drinking lots of water. Like you should take the aisle seat, because the person who's in the aisle seat is going to be so annoyed by you getting up, going to the bathroom all the time. That's what makes me happy when you are in a plane. Some of y'all are, I think y'all are my summer crew. I think we're like August due dates now. So no roller coasters and no water slides or jet skis, because I did have that question very recently. Question I have out here: when do you need to stop sleeping on your stomach? When your baby says stop sleeping on your stomach. So at a point, it will not be comfortable. You'll roll on your stomach and you'll feel boop, 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 your baby kicking you. So you can't harm your baby by sleeping on your stomach. You just won't be comfortable and you won't want to do it anymore. All right, last thing. Thank y'all. We're almost done. Upper respiratory updates regarding the vaccinations that I mentioned for early third trimester. ACOG moved from supporting either way to strongly recommend, based specifically on studying COVID vaccines in 2021 on 35,000 pregnant women. So if you plan to get a booster, Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because it has an independent risk of blood clots, and so does pregnancy. So if you're planning a booster and you're more than 6 months past your Moderna or Pfizer, go for it. If you're more than 2 months past your Johnson & Johnson, you can get a booster. Just don't get another Johnson & Johnson. Get Moderna or Pfizer, because mixing and matching is fine. If you're planning the flu, RSV, or Tdap, you don't have to space them out unless you just want to, because they all work differently, actually. If you do get COVID during pregnancy, there has been an association with gestational hypertension, so high blood pressure is related to pregnancy and contracting COVID during pregnancy. So we're still monitoring this. We don't recommend ivermectin, azithromycin, or Plaquenil for these things. What we do recommend is that you don't come in here and spread it to everybody. Convert to virtual appointments. Start taking your vitamin D3, your zinc, your vitamin C, and your baby aspirin, because the baby aspirin will reduce your risk of conversion to gestational hypertension. If you get COVID after 36 weeks, don't start the baby aspirin, because you're just going to increase your bleeding risk. And we do follow growth ultrasounds after a diagnosis of COVID in pregnancy, because we've seen growth restriction from the hypertension from COVID. We're still learning so much more about this illness. You don't need to come to the hospital if you're positive, unless you're having trouble breathing or you have a fever that you can't bring down with normal amounts of Tylenol. For those of you who had babies during the height of COVID care in hospitals, take a deep breath. It is different. We're back to normal. 4 visitors are okay, plus your doula. She's not considered a visitor. She's part of your birth team. We're not routinely masking in the hospital or in labor unless you are actively positive with COVID, RSV, flu at the time of delivery. And even then, we're not separating you from your baby. We give you N95 masks to protect your baby from your respiratory droplets, and an isolette to protect baby from the room respiratory droplets. And my last poll question has to do with what you can find on the website. Can you find birth plans? Can you find safe medications, what to expect at each visit? Or are you a stellar test taker and you know that the answer is usually going to be all of the above? All right, the polls are closing in 5, 4, 3, 2, 1, done. And you all are graduates of the Full Circle Orientation webinar. Congratulations. And everybody got this right. Fantastic. Please remember, we are social, so follow us on all the things. I had a young patient tell me very recently that our social media is not interesting and she wants to take over it. So if it starts to get better soon, it's not me, it's her, because I'm old and I do not log on to any of these things at any point. But we are on all of these things and occasionally we post. All right. All right. So thank you all very much for hanging with me today. I appreciate you. Remember that this will be available on our YouTube channel, and so you can watch this throughout the duration of your pregnancy. Thank y'all so much for hanging out with us. We do not take it lightly that you chose Full Circle to help grow your family, and we plan to live up to any of your expectations. If at any point someone does not, do not go to Google because Google cannot help you. Come to me. You have a portal, and you can send me a message, and I will do my very best to fix whatever it is and make it right. Okay? All right. You guys have a wonderful evening, and we'll look forward to seeing you guys in the office real soon. Okay? Take care.